Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. We recently had some episodes here on the Caregiver Minute about the importance of gut health. And a word that you hear a lot in association with gut health is the microbiome. Now, if you haven't heard of that, the microbiome refers to the collection of bacteria and microorganisms that live in a symbiotic relationship with the gut. There are bacteria in the gut that are absolutely critical for our health, and they have a whole lot to do with neurotransmitter production and hormonal signaling and a lot of other things that we're just beginning to understand. But the gut is not the only area where you find the microbiome. There are microorganisms that live all over our skin. Kind of gross, right? And there are microorganisms in the mouth as well. Maybe you haven't heard of the oral microbiome, but it actually has a lot to do with our health. And a simple thing that a lot of people choose to do might be damaging our health. The oral microbiome is very sensitive, and one of the things that can really affect it is use of mouthwash. Things like Listerine or mouthwashes that have an ingredient called chlorhexidine have been shown in multiple studies to dramatically deplete the bacteria in the mouth and totally disrupt that microbiome, in the same way that using an antibiotic destroys good gut bacteria along with the bad ones, and you might have some pretty damaging consequences as a result of that. Regularly using alcohol-based or chlorhexidine-based mouthwashes has been shown to make people more susceptible to illness because it disrupts the bacteria in the mouth. And a 2019 study published in the journal Frontiers in Cellular and Infection Microbiology shows that even 1 week of using a chlorhexidine-based mouthwash can do such damage to the nitric oxide pathway at the back of the tongue that it causes a measurable increase in systolic blood pressure. So if using mouthwash after just a week increases your blood pressure, we need to be really serious about how we look at something that seems as innocuous as a mouthwash. As we learn more and more about how the body functions, we're learning that some things that seem like little things are actually really big things. Maybe we should be rethinking the use of mouthwash, which is an interesting thing to point out here because we also talk a lot on the Caregiver Minute about how important oral health is overall. So we need to brush, we need to floss, we need to make sure that there isn't infection in the mouth because that can have a dramatic impact on our brain health and our overall physical functioning. But using mouthwash, unless it's just a saline rinse, probably not a good idea. I hope that's helpful to you and the people you serve, and I look forward to seeing you again tomorrow for another episode of the Caregiver Minute.